Dumping syndrome is a complex gastrointestinal disorder characterized by rapid movement of undigested food from the stomach to the small intestine. This video will explore its pathophysiology, classification, diagnosis, management, and impact on patients, helping medical professionals provide optimal care. Dumping syndrome occurs when food moves too quickly from the stomach to the small intestine, causing an increase in osmolarity and fluid overload. This leads to diarrhea and the release of hormones that cause dumping syndrome symptoms. Dumping syndrome can be classified into two subtypes, early and late. Early dumping occurs within 30 minutes to an hour after a meal, causing gastrointestinal symptoms and vasomotor symptoms. Late dumping occurs 1 to 3 hours later, resulting in neuroglycopenic symptoms due to low blood glucose levels. Dumping syndrome is associated with dysregulation of various hormones involved in gastric regulation. One such hormone is GLP-1, which is secreted by the L cells of the small intestine in response to nutrient ingestion. In dumping syndrome, there is an excessive release of GLP-1, leading to increased insulin secretion and subsequent hypoglycemia. GRP, on the other hand, stimulates the release of gastrin, causing increased gastric acid secretion, which contributes to the symptoms of dumping syndrome. Gastric emptying studies are important for diagnosing dumping syndrome. These tests measure how quickly food moves from the stomach to the small intestine. Scintigraphy and breath tests are commonly used methods to assess gastric emptying and confirm the diagnosis. In addition to gastric emptying studies, non-invasive diagnostic approaches can aid in the evaluation of dumping syndrome. Oral glucose tolerance tests involve measuring blood glucose levels at regular intervals after the ingestion of a standardized glucose solution. In individuals with dumping syndrome, blood glucose levels may drop rapidly, leading to the characteristic symptoms. Another non-invasive method involves measuring serum glucagon levels. Dumping syndrome is associated with elevated glucagon secretion, and assessing its concentration can provide useful diagnostic information. Proton pump inhibitors, such as omeprazole or pantoprazole, are frequently utilized in the management of dumping syndrome. These medications reduce gastric acid secretion by inhibiting the proton pump in parietal cells. By decreasing the acidity of gastric secretions, PPIs can alleviate symptoms related to gastric acid hypersecretion, such as heartburn, abdominal pain, and dyspepsia. However, it is important to note that PPIs do not directly address the underlying pathophysiology of dumping syndrome and should be used in conjunction with other management strategies. One of the hallmarks of dumping syndrome is reactive hypoglycemia, which occurs due to the rapid release of insulin in response to a sudden surge in blood glucose levels. To manage reactive hypoglycemia, dietary modifications are crucial. Patients are advised to consume smaller, more frequent meals and avoid high glycemic index foods. Medications such as acarbose, an alpha-glucosidase inhibitor, can help slow down carbohydrate absorption, mitigating the surge in blood glucose levels and subsequent insulin release. Dumping syndrome, a possible complication of bariatric surgeries like Roux-en-Y gastric bypass and sleeve gastrectomy, occurs due to changes in gastric emptying. Incidence and severity vary between procedures, with Roux-en-Y gastric bypass having higher rates and sleeve gastrectomy potentially reducing risk. For patients with severe and refractory dumping syndrome, surgical interventions may be necessary. In such cases, options include surgical revision of the initial procedure or conversion to a different type of bariatric surgery. For instance, conversion from Roux-en-Y gastric bypass to sleeve gastrectomy may be considered for individuals who have persistent and debilitating symptoms despite conservative management. Surgical interventions aim to alter the gastrointestinal anatomy to improve gastric emptying and alleviate symptoms. Dumping syndrome can affect pediatric patients who have undergone bariatric surgery or have underlying gastrointestinal disorders. Managing dumping syndrome in children requires special considerations due to their unique physiological and developmental needs. In addition to symptom management, the focus should be on optimizing nutrition and ensuring appropriate growth and development. Collaborating with a multidisciplinary team, including pediatric gastroenterologists, nutritionists, and psychologists, is crucial in providing comprehensive care for pediatric patients with dumping syndrome. Dumping syndrome can have a significant impact on patients' quality of life beyond the physical symptoms. The chronic nature of the condition, its effects on daily activities, and the restrictions it imposes on dietary choices can lead to psychological distress, body image issues, and social difficulties. It is essential for healthcare providers to be aware of these psychosocial aspects and provide appropriate support and counseling to patients, addressing their emotional well-being alongside the physical management of dumping syndrome. Dumping syndrome can contribute to the development or exacerbation of micronutrient deficiencies, including iron and vitamin B12 deficiencies. Rapid gastric emptying and altered absorption in the small intestine can impair the uptake of essential nutrients, leading to deficiencies. Dietary interventions, such as increasing intake of iron-rich or vitamin B12-rich foods, are typically recommended. In severe cases, supplementation may be necessary. Close monitoring and periodic assessment of micronutrient levels are vital to ensure optimal nutritional status in patients with dumping syndrome. Dumping syndrome is a complex disorder caused by rapid gastric emptying after surgery or gastrointestinal disorders. Accurate diagnosis and management require understanding of pathophysiology, hormones, diagnostics, and therapeutic strategies. Psychosocial impacts, micronutrient deficiencies, and multidisciplinary care are important for optimal patient outcomes.